the major cause of death globally, and keeping the rhythm of heart to its natural state is very important to save the person's life. So afibrillated heart means it is a desynchronized heart rate. It is not. It is a PDF, so that's why you're not seeing animation here. So it is a normal heartbeat, and here we can see an abnormal electrical activity, especially in the in the right atrium of the heart, and this causing an abnormal heart beat, and that need to be resetted by using a device called AED. So when we are giving this AED, we should not touch the person. If you are touching the person, even we will get shocked or electrocuted. So when we are performing this AED, we need to ensure that no one touching the patient. And also the steps are like this. So first we need to see whether the patient is breathing or not. If he is not breathing, immediately we need to start giving 30 chest compressions CPR and 2 rescue breaths. Then even after that, still the patient is not responding, means immediately we should seek the help of AED. AED stands for automated external defibrillator. So we will keep 2 electrodes, one electrode on the right shoulder and another electrode on the left rib. Okay, on the bottom left rib cage we will keep the second electrode, and we will start the AED. Before starting or giving electricity to the patient, we need to ensure that the patient lying on the ground, there is no water on the ground or the floor is not wet. We need to ensure that no one touching the patient, and also we need to ensure there is no electrical devices in the patient. Either it can be in the pockets or inside the patient. Inside the patient, I mean, some will have ear implantations like audio devices, or someone will have pacemakers. So to such persons, we should not give AED. And also AED is not recommended for children. Children age below 8 years are not recommended for giving AED. Just imagine, keep a chicken leg on a plate and give electricity to the chicken leg and see what will happen to the leg. It will start boiling. The meat will start boiling because of electricity. So giving a high voltage electricity is always dangerous, but in emergency situations we can give in a controlled manner by using a machine called AED. So we know that how the AED works. AED stands for automated external defibrillators, which is an electric box which is used for resetting the heart rhythm. And the principle is it will give a very high voltage electric current will be given to the patient. So the heart natural rhythm will be resetted. So this is how the AED looks like. It's a simple device with 2 electrodes. Sometimes it will come with a remote. So all you need to do is you need to place the electrodes on the body and you need to click it. So now this, after keeping the electrodes on the chest, keep in mind when we are placing these electrodes, we should not use any alcohol swabs. Usually we will use alcohol swab for giving any injections or anything on the skin. In case of AED, we should not keep any alcohol. That is one contraindication. After placing these electrodes, now we need to switch on the machine. Now this machine will take the inputs from the body. It will read and it will say whether the patient requires the electricity or not. Only if the patient requires, then only it will deliver the shock after giving an alarm. It will say stay away from the patient, then it will give electricity. That is why it is called automated. It will automatically reach the patient electrical activity and it will deliver the shock. So that the same working principle. So the procedure is turn on the AED, expose the chest of the patient, attach the electrodes on the chest without applying any alcohol, then plug the chest connector to the device, then make sure that no one touching the patient, I mean stay clear, then analyze the rhythm. After turning on the instrument, it will start showing the rhythm. We need not to worry about the output or the rhythm. It will give normal or abnormal. It will give normal rhythm or abnormal rhythm. If it says abnormal rhythm, it will give us a alarm. Then after giving the alarm, the point is not here. It will analyze the rhythm. It will give, if he requests shock, it will give us an alarm. Then it will deliver the shock. Okay. So after delivering the shock, and once again we need to start repeating the CPR. So in between CPR, we need to give this frequent electric shocks until the patient becoming conscious. So this is the procedure of using the AED or automated external defibrillator. That's it. The same story in a paragraph manner. Turn on the instrument, place the electrodes, start the device. It will take care of it. Ensure that no one touching the patient during the procedure. So some safety precautions, as we discussed, we should not touch the patient. We should not wipe the chest with a alcohol swab. We should not turn on this device around any flammable material, such as in the petrol bunk. So you immediately need to take the patient from petrol bunk to the another place, because there are inflammables. They can catch fire. And also we should not give AED when the patient is in ambulance. When he's in moving, we should not give this AED. Okay, so these are the few precautions that we need to take before performing the AED to the patient. That's it. Advantages: we can bring back 70% chance of survival by giving AED. Okay, so that the chance of survival after an ischemia, after a heart attack, is high by using this AEDs. There are a few disadvantages. One of the major disadvantage is it will give electricity. That is not a big deal. But when the normal patient got electrocuted, he will get a heart attack. So that is why we should not touch the patient. AED is only for the victims, not for the rescuer. Okay, that's it. I hope AED is clear for everyone, right? Shall we proceed to the today's topic?
Yes.
Yes. So that is all about AED. And okay. Okay, coming to today's topic. Today's topic will be really interesting. Okay. Just let me know if you see this PowerPoint, students. What are you seeing on your screen? Read it.
Managing an emergency, moving a patient.
Moving a patient.
Okay. Himanshu, don't use mobile. See, I'm seeing many times. Okay, so coming to the point. So my next topic is managing an emergency situation, especially how we need to move the patient. For example, there is a bike accident on the road and the patient is laying on the road. What are the possible complications to the guy? Just imagine a person met with a bike accident. So what will be the complications to that person? If you go and you saw the patient on the ground, will you immediately lift him? No, sir. No, right? Why? What will happen if you lift the patient from that area? He may have some neck injuries. He may have some spinal cord. Some of his bones may be broken. If you are lifting, the bone may even more break. Right? There might be some crack. When you are lifting him, it may completely break apart. So first of all, we should not move the patient in the emergency situation. Rather than, we need to keep some stretches. If we suspected any breakage of bone, first keep some scale, okay, any wooden stick, and you need to wrap identify where is a break, and you need to immobilize that part. After immobilizing that part, you should move the patient. That is why we will keep the structure immediately. So we will keep the structure beside the a table, and we will shift the patient to the table, and we will strap him, because we should not move the patient who met with an accident. Okay, that is one important thing. And second one is, there is something called pneumothorax. Pneumothorax means okay, a patient he attempted suicide by jumping into a river. So when he jumped into river, what will happen? He will engulf so much water. Okay, that is one problem. If that is the case, immediately you will give CPRs and oral breathing, so he will recover. Before that, you may give Hammond procedure by chest compressing his chest. Even after that, also, the patient cannot breathe in some conditions. At that condition, when he has air in the lungs, he cannot breathe. Air not inside the lungs. I need to tell you some basic anatomy. So inside there is lung. Okay, here there is lung, and this lung is protected by two layers. Okay, there are two layers, and these layers are called pulmonary layers. Okay, in these two layers there is a gap. This gap is called peripleural space. Okay, advantage of having this gap is when the lungs are moving, these layers will move like this, and in this space we have some fluid, and this fluid will keep the lungs, it will lubricate. Okay, so lungs won't damage during this movement. But in emergencies, this gap will fill with air, excessive air. If excessive air present here means lung cannot compress. This air will entrap the lung movement, so lung cannot move. If the he can, and this on the top layer, you can stab around here, so the air will come out. That is one of the important emergency rescue that we can do to a patient. I don't know whether online students understood or not. I will show you one nice clipping, students. Just watch it. Then we can proceed to the lecture. So there is a movie. Students in online, are you listening?
Yes,
Yes,
sir.
sir.
Okay.
Yes, sir.
Okay.
Yes, sir.
So there is a movie of Jackie Chan, and this movie is called Who Am I? I used to see this movie in my childhood, and I particularly like this particular scene. So just see this clipping here. Okay, he became a tribe and he will come back to society here. So he will see that someone has a problem, and let us see how he will rescue them. He saw that the person got a snake bite and he's unable to breathe. Usually snake bite will cause surfactants. The lung will accumulate with some foam. So he's unable to breathe and he has a snake bite. She thought he's killing. Actually, this is not recommended. You should not directly remove venom with your mouth. Rather than you should use some suctions. So this step is not recommended. Since it's movie, they did it. Yeah, who am I?
He's not a tribe when he came from somewhere like parachute.
He will. These things are not recommended, okay? Anyway. He forgot his language. venom containing blood. Then he stopped the bleeding and he applied a dressing here. So he applied some pressure on the wound, so there won't be any further bleeding. After applying pressure, okay. He saw that the patient is not breathing. I think that breathing is not here. So he suspected that he is unable to breathe. He took a pin, a puncture pin. Okay, he's giving ORS to the patient. This is not pneumothorax, I thought. Rather than he's just giving ORS by coconut water. So coconut water has a proper salinity, which can be introduced directly into the blood. So what he did is he took a coconut and he directly infused coconut water into the patient. He took the basketball gas, the air pin. Okay, that scene is not from this movie.
After surgery, also recommend coconut water.
Okay. Oh, disappointed. Okay, all right. Now, whatever that Jackie did in this video, okay, that is emergency care and emergency movement of the patient, and he didn't show the removal of pneumothorax or air from the lungs. What we will do is simply we need to insert a needle into the thoracic cavity. After inserting a needle, you will hear a pop sound, just like a balloon releasing air after punching it. So similarly, the air will be removed and the patient will start breathing. And that is one technique, okay, that is extremely useful in case of pneumothorax conditions, okay, which is an emergency situation. So usually first we need to do these following parameters. When a patient is in emergency, we need to check a primary survey of ABCDE. A stands for airway, whether his airway is open or not, whether he is breathing or not, whether he has circulation or not, circulation, heartbeat, whether he has any disability, can he able to move or not, or whether he is conscious or not, and his exposure, what type of exposure he got, either it is a burns injury or it is a mechanical injury or it is a drowning. So we need to see what kind of exposure the patient has. So this is the primary survey we need to do. After doing the primary examination, we will go with these following parameters. So vital parameters: temperature, heart of the patient, respiratory pressure, oxygen saturation in the blood. This will be done especially in emergency ward in the hospital. Only in the hospital we will have a clip oximeter. So if you keep that clip, automatically you will get the oxygen saturation level of the blood. And we also see, we should see something called pain score of the patient. If there is any amputated nerves within the limbs or within the especially within the links, the patient cannot feel the pain even though we are pinching him. So we need to see the pain score of the patient, and also we need to do something called GCS. GCS stands for Glasgow Coma Scale. Glasgow Coma Scale means there is a severe misunderstanding about coma. Coma doesn't mean patient becoming forever bedded or patient will be at least 10 days in bed. Sometimes coma can occur due to spontaneous unconsciousness. So spontaneous unconscious can also be stated as a coma. Now we need to see what type of coma it is. We need to assess it is either it is a temporary coma, a chronic coma, or permanent coma. How to assess that the state of coma of a patient? So that can be done. That can be done by a scale called Glasgow Coma Scale, okay, GCS, Glasgow Coma Scale. So they will give readings. They will 1, 2, 3, 4, 1, 2, 3, 4, 5. Whether he can able to respond verbally with us or not, whether he can able to move or not. So depending upon these 3 parameters, we will use scaling to the patient, whether his eyes open or not, whether he's speaking or not, and whether he's moving or not. If his eyes are open, to what extent? Completely closed eyes, to pain his, okay, I will show the next one. Okay, the definition of Glasgow Coma Scale is used to describe general level of consciousness of a patient, okay, who has these 3 problems. Either it can be eye opening, motor response, movement, or it will be verbal response. So what we will do is we will ask the patient to, we need to ask what is his name. If he's responding means, if he's telling his name means, that indicates his airway is normal. When we speak with the patient, when he replied to us means, definitely that indicates he has a proper breathing. He has a good breathing. That means we need not to worry about his breathing issues. Then we need to ask whether he can move or not. If he is not moving, that indicates a problem with amputation. And also we need to check one more, verbal response. Okay, eyes. Eyes is the first one. If he's opening his eyes means that indicates he's conscious. Okay, so this is the scale. Eyes open or not? Is there speech or not? Is there any movement? Sometimes patient may open eyes, but he cannot speak or he cannot move. That indicates breathing abnormality. Sometimes he can open eyes and he can speak, but he cannot move. That indicates limbs problem. Or he can spontaneously he'll open eye and he will close it. That indicates the confused state. Okay, and there is no eye movement means that indicates a real coma. So the severity will go more. Okay, from 1 to 6. 6 is more severe, 1 is less severe. So this is Glasgow Coma Scale. Then after that we need to do the following parameters. We need to prepare for the emergency. We need to assess the triage. We need to see the level of emergency, level 1, 2, 3, 4, 5. We need to see the primary survey of ABCDEs, airway, breathing, circulation, then D. What is this D? Circulation, disability, and exposure to the patient. So we need to see ABCDs, and we should start giving resuscitation. That means external CPR to the patient. Then the second protocols include AED can be given if the patient is not responding. So these are the parameters of moving the patient. So ABCDE, once again, airway maintenance, breathing and ventilation, circulation, disability, and exposure or environmental control. It's a simple topic, students. So first one is we need to ask the patient what is his name. If he's telling his name, that indicates there is no airway is not compromised. Okay, he can speak. There is no problem with the air pathway, and we should ask if the patient can able to efficiently communicate with us means that also indicates he has a good conscious state of mind. That means he's good. He's not so severe. He's not too anxious, or the patient is not fearing of the condition. And we need to see any traumatic incidents. Traumatic incidents means, is there any bulging of skin? Bulging of skin indicates internal blood blood leaking. Okay, so in case of internal hemorrhage, we will see swelling of skin. So if we need to suspect, is there any skin swelling? If the swelling is in the chest cavity, immediately we need to suspect pneumothorax. Okay, pneumothorax is a part. And if the patient cannot move his head means that indicates he has some cervical vertebra damage. That condition, neck aid, and we need to keep the patient immobilized. Okay, then we need to check for breathing of the patient. If we suspect there is a problem with the breathing of the patient, then we should do something called we should suspect pneumothorax. Pneumothorax means entrapment of air in the pleural space. If that air entrapped in the pleural space means patient cannot breathe. And there is one web series I recently saw this. This web series is The Good Doctor. So in this, this character is a MBBS pursuing student, and he will rescue people when he saw them in emergency situation. So let me show you one example of rescuing if a person has pneumothorax. So someone already started giving oral rescue breaths, and the doctor came, and let us see how he will rescue him. See, he came with 2 alcohol bottles. This patient has pneumothorax. He's unable to breathe. So he is using the alcohol for sterilizing the skin. Very bad. You should not blow gloves with air. Then he sterilized his gloves. So he suspected pneumothorax in the left lung. So he took a needle. Since he's a trained doctor, he knows where he need to insert, but this is not for everyone. So the air will be removed. Already air came out. He's introducing the catheter to remove excess hemothorax. I mean, his air came out. Yeah, this is called rescuing of hemothorax condition, pneumothorax condition. Pneumothorax means entrapment of air in the lungs. So this was rescued by this small insertion on the thoracic cavity. So that is called pneumothorax rescuing. See one more animation on pneumothorax. So this child has a pneumothorax condition. So his right lung has excessive air. So the lung is not functioning properly. Okay, we need to introduce a catheter into the thoracic cavity, and this catheter will remove the air, entrapped air. See, after removing this air, lung came to its natural state. So this is all about a pneumothorax rescue. One more similar incident. So here the emergency team came. They assessed the patient. They have given back wall mask. Still, the patient is unable to breathe properly. That indicates this patient has pneumothorax condition. So he's hearing the air by stealth. So if there is air entrapment means we can hear there is a specific sounds. By hearing the sound we can know. So take a large gauze needle. So this is all about pneumothorax, and that can be removed by placing a needle in the chest cavity. So that is called tension pneumothorax. So immediate decompression of the chest is required, and that can be done by punching a needle at the third intercostal space or below the third rib. Okay, so this you can go through the notes to get how to perform this technique. So after finishing pneumothorax, you need to dress it, or you need to close the site of insertion with a well sealed manner. Okay, that depends upon the availability. So this is all about pneumothorax rescuing. Then we have one more condition called hemorrhage. Hemorrhage means leakage of blood into the skin, or internal leakage of blood is called hemorrhage. So hemorrhage are of two types: external hemorrhage and internal hemorrhage. External means bleeding outside the body. Internal means bleeding inside the body. So external hemorrhage can be prevented by applying a force on the place where he has bleeding. And also we need to raise his arms or legs or arms, okay, so that the circulation will be reduced. So you need to raise the area where, or you need to tourniquet it. Either you need to raise the leg or you should tourniquet it. You need to tie a knot here, so that there will be less blood flow to the site of injury. So that is how we can control bleeding. So these are few techniques of controlling bleeding. Okay, apply some dressing, apply some pressure, so the bleeding will be stopped. And you need to apply a tourniquet. You need to knot down the arteries. The sign of internal bleeding is turning the skin into purple color, okay, or a deep brown color. So this discoloration of skin indicates there is a severe bleeding in this right brachia, the right hand. Here, so his bone may broke around here, and blood started leaking, and it accumulated in this part. So this need to be rescued only after admitting the patient in the hospital. So this cannot be done at on the spot. Rather than it can be cured inside the emergency ward. We are only discussing about a first aid during an emergency care. Okay, we are not discussing about internal hospital care. I'm not discussing the physician aspects of emergency care. So neurological conditions. So neurological conditions means patient cannot move. So unable to, lack of mobility of the patient indicates he has some spinal cord damage. So whenever there is spinal cord damage, patient cannot move, and that need to be assessed properly by Glasgow Coma Scale, and we need to respond appropriately. So that's it. So all you need to do is, during an emergency situation, you need to remember ABCDE: airway, whether the patient airway is open or not, whether he's breathing or not, whether he has circulation or not, whether is there any disabilities of the patient, and also is there any environmental exposure like fire, water, or any other hypoxia in higher altitudes. So that need to be restored. This topic is very simple topic. You can go through it. Okay. Any doubts in patient mobility? I will ask you a few questions from this topic. Okay. Students in online, is everything clear so far?
Yes, sir.
Yes, sir.
Yes, sir.
Yes. So I will do a quick revision and we can wind up. A quick revision of today's lecture. So in today's lecture, we discussed about emergency movement. So here I introduced a new concept called Glasgow Coma Scale. So Glasgow Coma Scale is used for assessing the level of consciousness state of the patient. So this can be assessed by three parameters: whether he's opening his eyes or not, whether he's moving or not, and whether he's speaking or not. So with these three parameters, we will see the consciousness state of the patient. Then I discussed about
12 से gap मिलेगा.
हाँ?
खाऊंगी.
I'm
तो
not
नहा तो जाओ.
milk, it seems.
कम से कम.
Mute. Okay, so then we discussed about primary assessment, then we discussed about few things. Okay, we need to immobilize the patient, then we need to check any neck injuries, and we need to suspect a pneumothorax. If there is pneumothorax, Immediately we need to remove the air from the pneumothorax by placing a needle at the third intercostal space of the thoracic cavity, usually on the right side, and we need to remove the air from the pleural space. Then we discussed about closing the site. We need to close this area of insertion properly. If not, there will be a cross contamination or secondary infection. Then I discussed about the bleeding. There are two types of bleeding: internal bleeding and external bleeding. External bleeding can be prevented by applying a pressure on the site, and you need to keep a dressing over it. And also you need to tie a tourniquet to decrease the circulation, blood circulation to the site of injury. And if you suspected internal bleeding, immediately we need to shift the patient to the emergency ward. Internal bleeding indicates or it is a sign of internal bone breaking. Okay, internal breaking of bones. Then you need to assess with a glass glaucoma scale to assess the consciousness state of the patient. Thank you very much, students. Your class over. From tomorrow onwards, we can start Unit 3. Yes.
Thank you, sir.
Yes, you can leave.
Thank you, sir.
Yes, students, see you.